matter?
I mean, what we do know about hospitals and secondary, tertiary care, it tends to be the more sick patients, the intensive care patients, high dependency. The very susceptible patients who may be unconscious, they'll be on intubation, perhaps ventilation. It's those types of patients that are the most at risk from having a bloodstream infection and succumbing to that infection. On the general wards, MRSA infections are fairly common. Surgical wards, they might have infected wounds and so on. But you're always going to have staff. You're always going to have a proportion of staff in the UK, a proportion of patients who are colonised with MRSA. Currently, we don't look for MRSA colonisation. We look for it in blood cultures, and we base our infection control on that. So I'm just moving to the chap's actual question. I mean, I think in my talk I said that the reason the Netherlands have a low MRSA prevalence is because they've never had a high prevalence. They've never let it go. In the early 90s, they had search and destroy, robust infection control. We didn't really wake up into the MRSA problem that we have currently. We didn't really wake up until about 2000, when John Reid, actually the health secretary, said, hold on, we need to do something about that.